Do you ever find yourself struggling to get or keep a firm erection? Feeling that familiar frustration and maybe a quiet worry about what's happening with your body? It's something many men face as they get older. And it's a topic often surrounded by silence and embarrassment. You might wonder if it's just part of aging, or if there's something specific going on that you haven't quite figured out. The truth is, while changes do happen with age, sometimes a seemingly innocent habit, something you might not even consider harmful, can actually be contributing significantly to this problem. It's a mistake that many men make, often for years, without realizing the quiet impact it's having on their ability to get hard when it really matters. In this video, I want to talk openly and honestly about this common mistake, explain why it's happening, and more importantly, what you can do about it. It's a secret that, once understood, can truly change things for the better. Watch right to the end, because I'll reveal something that might genuinely surprise you and offer a path forward. Let's get right into it. As a surgeon who specializes in men's anatomy, particularly issues concerning the penis and erectile function, I've spoken with countless men over the years about their experiences, their worries, and their habits. And one common thread, a consistent pattern I've observed when men talk about their challenges with erections, often points back to a specific, seemingly unrelated activity: how they approach solo sexual activity, or masturbation. Now, before you dismiss this, hear me out. Masturbation itself is a normal and healthy part of life for many men, regardless of age. The issue isn't the act itself, but rather a particular way of doing it. A technique that is incredibly common, especially because it can lead to intense pleasure quickly, but which, over time, can inadvertently train your body in a way that works against achieving and maintaining erections during partnered sex. The mistake I'm talking about is the habit of using excessive pressure, combined with a very rapid, narrow, and highly specific technique focused intensely on just one small area of the penis, often using a grip that's much tighter and more consistent than what's typical during intercourse with a partner. Think about it. Many men develop a habit of using a very firm grip, almost like a vice, and then applying incredibly fast, repetitive strokes with a high level of pressure. This technique becomes the primary way they achieve orgasm and erection on their own. It feels powerful, it feels effective in the moment, and it quickly becomes the go-to method. And this is where the problem silently creeps in. Your body, specifically the nerves in your penis, are highly adaptable. They learn and respond to the stimulus they receive most often. When you consistently use a very high level of pressure and a very specific, often narrow, area of stimulation, your nerves gradually become less sensitive to anything less intense or less focused. It's like turning up the volume on your stereo higher and higher. Eventually, you need that incredibly loud volume just to hear anything clearly. Similarly, your nerves get used to that high pressure, high-intensity stimulus. So, what happens when you are with a partner? Intercourse, by its nature, involves a different kind of stimulation. There's less constant, focused pressure. There's more variation in speed, angle, and depth. There's the natural lubrication of the partner, the warmth, the different textures and sensations involved in vaginal or anal sex. Compared to that very specific, high-pressure solo technique, the stimulation from a partner can feel significantly less intense. Your nerves, having been trained to respond primarily to that higher level of pressure, might simply not register the stimulation from your partner as sufficient to achieve or maintain a full, firm erection. It's not that your partner isn't stimulating you. It's that your body's threshold for what constitutes enough stimulation has been artificially raised by this solo habit. I've seen this pattern emerge frequently. Men come in, worried they have a serious medical issue, describing how they can get a perfectly good erection on their own using their usual method. But when they are with their wife or partner, the erection is weak, or they lose it quickly. They feel confused, frustrated, and often incredibly embarrassed, sometimes even blaming their partner or themselves in unhealthy ways. But often, the underlying issue isn't some sudden, catastrophic failure of their body. It's a gradual adaptation, a learned response to a specific, intense stimulus that they have reinforced over months, years, or even decades through their solo habits. This creates a disconnect, a gap, between what their body has been trained to respond to and the reality of partnered intimacy. And the longer this habit continues, the wider that gap can become, making the problem feel more entrenched and harder to overcome. This isn't about shaming anyone. It's about understanding a common physical and neurological principle at play. Your nervous system is remarkably efficient at adapting. It figures out the quickest, most effective path to the desired outcome, in this case, orgasm, based on the stimulus it receives. If that path consistently involves extreme pressure and a narrow focus, it becomes incredibly good at responding only to that. It effectively downregulates its sensitivity to milder, more varied input because it's learned it doesn't need it to reach the goal. And that adaptation, that reduced sensitivity, is what makes partnered sex feel less effective at achieving or maintaining an erection. It's a silent process, one that often goes unnoticed until a man tries to be intimate with a partner and finds things aren't working the way they used to. It's a frustrating situation, made even more so because the very thing they might be using to feel sexually capable on their own could actually be hindering their capability with a partner. So, the first step in addressing this is recognizing that the way you stimulate yourself solo might be contributing to the problem. It's not about frequency. It's often about the technique and the pressure involved. This awareness is the crucial first step towards making changes that can bridge that gap and help your body relearn how to respond to the natural, wonderful stimulation of intimacy with another person. Now that we've discussed this common mistake and how it creates a disconnect, let's talk about the longer-term consequences and what can happen if this continues, before we get into what you can do about it. Now, you might wonder how this gap gets wider and what it really means long-term for your ability to get and keep a strong erection. If this high-pressure, narrow-focus solo habit continues, the desensitization I mentioned can deepen. The nerve endings aren't gone, of course, but their sensitivity to lower levels of stimulation is effectively muted. Think of it like trying to enjoy a quiet conversation in a room where someone is constantly shouting. Eventually, you tune out the conversation and only react to the shouting. Your nerves become so accustomed to the shouting of high pressure that the conversation of partnered touch just doesn't register strongly enough to trigger the full cascade of events needed for a robust erection. The nerve signals telling the blood vessels to open up and allow blood flow. This isn't just about physical sensation. It often has a profound psychological impact too. As a man repeatedly experiences difficulty getting or maintaining an erection during partnered sex, while perhaps still being able to achieve one solo, he can start to develop performance anxiety. He might feel embarrassed, frustrated, and start avoiding intimacy altogether, or enter intimate situations with a sense of dread, wondering if it will fail again. This anxiety itself can release stress hormones like adrenaline, which constrict blood vessels, making it even harder to get an erection. So, what starts as a physical desensitization can easily spiral into a psychological barrier, creating a vicious cycle that reinforces the problem. The man blames himself, feels less confident, and the anxiety makes the physical issue worse. Furthermore, while less common, some urologists and sexual health experts also speculate whether consistently using excessive, harsh pressure during solo activity over many years could potentially contribute to subtle tissue changes or even microtrauma over time. Though the desensitization aspect is the more widely recognized mechanism behind the solo versus partnered erection issue, the main point is, the body adapts to the stimulus it receives. And if that stimulus is consistently unnatural in its intensity and focus compared to partnered activity, It creates a mismatch that makes natural intimacy less effective at triggering an erection. This is where the crucial shift needs to happen. The solution isn't necessarily to stop solo activity entirely, though for some, a temporary break might be helpful, but rather to change how you do it. The goal is to retrain your nerves to become more sensitive to a wider range of natural stimulation, the kind you would experience with a partner. This means consciously moving away from that intense, high-pressure, narrow focus technique and adopting a gentler, more varied approach. So, what does this look like in practice first and foremost? It means drastically reducing the pressure you apply. Experiment with using a much lighter grip, more akin to holding someone's hand or gently stroking. The key is to focus on sensation, not just achieving the fastest possible orgasm. Explore different levels of pressure, from very light touching to moderate pressure, but avoid that super tight, gripping technique. Second, vary the technique itself. Instead of rapid, repetitive strokes focused on just the shaft, try incorporating different movements. Use the whole hand, not just the fingers in a tight circle. Explore different areas of the penis, the head, the frenulum, the underside near the tip, the base. Use both hands, or alternate hands. Change the speed and rhythm. Make it less mechanical and more sensual. Think about mimicking the natural variations in touch, pressure, and rhythm that occur during partnered sex. You could also incorporate lubrication more liberally. Using a good quality lubricant can allow for smoother, less abrasive movement and can help you focus on the sensory experience rather than relying solely on friction and pressure. Experiment with different types of lubricants to see what feels best. Another helpful approach is to integrate fantasy or visual stimulation with this gentler technique, but focus on maintaining the erection with less pressure. The goal isn't just orgasm, it's maintaining a firm erection with a more natural level of stimulation. This might require patience. Your nerves have been trained for a long time, and retraining them won't happen overnight. It might feel less intense at first, maybe even frustrating, because your body is expecting that high-pressure hit. But consistency is key. By consistently using a gentler, more varied technique, you are gradually teaching your nerves to respond effectively to lower, more natural levels of stimulation. You are effectively lowering that sensitivity threshold back down, bringing it closer to the level of stimulation you would receive from a partner. Think of it as recalibrating your body's response. Over time, with consistent practice, you should start to notice that less intense stimulation feels more pleasurable and is more effective at maintaining an erection. This process helps bridge the gap between solo activity and partnered sex, making the transition between the two much smoother and increasing your chances of achieving and maintaining a firm erection during intimacy. This change in technique is a powerful step, one that puts you back in control and directly addresses a common, often overlooked cause of erection difficulties in older men. It requires mindful effort and a willingness to break an old habit, but the potential rewards, increased confidence, improved intimacy, and better erectile function, are well worth it. This change in habit is a crucial piece of the puzzle, but it also fits into a larger picture of maintaining your health and vitality as you age. Next, we'll dive into some other important areas that support overall erectile health and how making changes in this specific area fits into that bigger picture. Changing how you approach solo activity, shifting away from that high-pressure, narrow focus technique towards a gentler, more varied approach, is incredibly powerful, and it directly addresses a common, often silent contributor to erection issues. It's about retraining your body, and it's a change that many men find makes a significant difference. But as I mentioned, it's also part of a larger picture of maintaining your health and vitality as you get older. Erectile function is intimately linked to overall health, particularly vascular health, nerve health, and even mental well-being. Think of your ability to get an erection as a report card for your cardiovascular system. Getting and maintaining an erection requires healthy blood flow, Blood vessels need to relax and expand to allow blood to fill the penis, causing it to become firm. Conditions that affect blood vessels throughout your body, like high blood pressure, high cholesterol, diabetes, and atherosclerosis hardening of the arteries, are often underlying causes of erectile difficulties. These conditions restrict blood flow not just to the heart or brain, but also to the penis. So, while addressing your solo habits can directly impact nerve sensitivity and learned responses, it's also vital to pay attention to these other aspects of your health. Simple things like staying physically active can make a huge difference. Regular exercise, even moderate activities like brisk walking, swimming, or cycling, improves circulation and overall cardiovascular health. It helps manage weight, blood pressure, and cholesterol levels, all factors that contribute to healthy blood flow. You don't need to become a marathon runner. Finding enjoyable ways to move your body consistently is what matters. What you eat also plays a significant role. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, like the Mediterranean diet, supports vascular health. It helps keep your blood vessels in good condition, allowing for better blood flow. Limiting processed foods, sugary drinks, and excessive saturated or trans fats can also have a positive impact, not just on your weight, but directly on the health of your arteries. Managing stress is another critical, often overlooked factor. Chronic stress and anxiety can release hormones that constrict blood vessels, making erections harder to achieve. Finding healthy ways to cope with stress, whether through mindfulness, meditation, hobbies, spending time in nature, or talking to someone, can be incredibly beneficial for both your mental health and your physical function, including erectile function. Sleep quality is also important. Your body repairs and rejuvenates itself during sleep, and chronic sleep deprivation can negatively impact hormone levels and overall health, which in turn can affect erectile function. Aiming for 7 to 9 hours of quality sleep per night is a goal worth prioritizing. Pelvic floor muscles also play a role in maintaining erections by helping to compress veins and keep blood in the penis. Simple pelvic floor exercises, often called Kegels, can strengthen these muscles. These exercises involve squeezing the muscles you'd use to stop the flow of urine. Doing a few sets of these contractions each day can help improve the firmness and duration of erections. The key takeaway here is that while correcting that specific masturbation mistake is a powerful step you can take to improve your erectile response, it works synergistically with these other healthy habits. You are taking a proactive approach to your sexual health, addressing a specific learned behavior, and supporting that effort by nurturing your overall physical and mental well-being. It's not about finding one single magic bullet. It's about creating a lifestyle that supports healthy function in all areas of your life. Remember, making changes, even small ones, in these areas, your solo technique, your physical activity, your diet, stress management, sleep, and pelvic floor strength, can have a cumulative positive effect. It's about empowering yourself with knowledge and taking consistent, positive action. It's never too late to start making these kinds of changes. Many men I've worked with have seen significant improvements in their erectile function and their confidence simply by understanding these principles and putting them into practice. It takes effort and patience, absolutely. But the rewards are immeasurable, feeling more capable, more confident, and being able to enjoy intimacy more fully. So, take this information and apply it to your own life. Start experimenting with that gentler, more varied solo technique. Look at where you can make small improvements in your daily habits related to diet, exercise, stress, and sleep. These steps might seem simple on their own, but together, they form a powerful strategy for improving and maintaining your erectile health as you get older. Don't let frustration or embarrassment hold you back. Understanding the issue is the first step, and taking action is the path to feeling better and more confident. So, We've talked about that common mistake many men make during solo activity, using excessive pressure and a narrow, intense technique, and how it can inadvertently desensitize your nerves over time, making it harder to get and keep an erection during partnered intimacy. We explored how this creates a disconnect and can even lead to frustrating performance anxiety. And importantly, we discussed practical steps you can take to address it by consciously adopting a gentler, more varied approach to solo stimulation. You can help recalibrate your body's response and bridge that gap. We also touched on how this specific change fits into the broader context of overall health. How good vascular health, managing stress, staying active, eating well, getting enough sleep, and even strengthening your pelvic floor muscles all contribute to better erectile function as you age. Remember, it's not about blame or shame. It's about understanding how your body works and how habits can influence it. Recognizing this common mistake is the first brave step. Implementing the changes we discussed, focusing on gentler, more varied solo techniques, is a powerful way to regain control and improve your body's natural responsiveness. And by supporting this with positive lifestyle choices, you're building a strong foundation for not just better erectile function, but overall health and well-being. You are not alone in facing these challenges. And more importantly, you are not helpless. Small, consistent changes really can make a big difference. Be patient with yourself. Stay consistent with the new approach, and celebrate the small victories along the way. I truly hope this information has been helpful and has given you a new perspective and practical steps to take. I'd love to hear your thoughts, or if you have any questions about what we discussed, please feel free to share your experiences or ask anything in the comments section below. Your insights can also help others who are going through similar things. If you found this video valuable, please give it a thumbs up. It helps me know what topics are most useful to you. And if you haven't already, consider subscribing to my channel. I share regular videos focused on men's health and well-being as we navigate the journey of aging, providing information and tips to help you live your best life. Taking care of your health, including your sexual health, is an important part of living a full and confident life at any age. You have the power to make positive changes. Keep learning, keep taking action, and keep focusing on feeling your best. Live your best life at every age.